the presentation. At any point during the presentations, just feel free to pop your question in the chat box in English or in French, and then we will have some time for speakers to respond to questions at the end of the webinar. So if we can move to the next slide, please. So just to give a brief overview of our agenda and our speakers today. So my name is Christine. I'm a technical advisor in GBV with Mercy Corps. And then I'm going to be kicking us off today with a general overview of the SAGE program structure and also the implementation toolkit. I will then be handing over to my colleagues Zainabou Seydou and Ibrahim Hamidou from Mercy Corps Niger. And they will be sharing with us today their experience implementing SAGE in the very challenging context of Abala in Western Niger. And then I'll be passing to our colleagues from WRC, Monica Gifrida and Andrea Corris, who will be sharing some top-line findings from the evaluative research that WRC has been conducting on the SAGE program. And then, as I mentioned, we'll have some time for Q&A at the end of the webinar. So if we can move on to the next slide, please. Kevin, if you can move to the next slide. Great, thank you. So first, just to define what SAGE is about. So SAGE stands for Sibling Support for Adolescent Girls in Emergencies. It is an intervention that aims to reduce violence against adolescent girls in humanitarian settings via a gender-focused, family-based life skills curricula for girls, for their male and female caregivers, and for their older male siblings. So 4 different cohorts, as we call them. And these curricula are normally given over the course of 12 weeks. And during this time, these 4 cohorts take part in separate but simultaneous sessions that cover topics related to gender roles and attitudes, healthy relationships and communication, personal safety, gender-based violence, health, puberty, and family functioning and parenting. So if you can move to the next slide, please. So just to give some background on how this approach came about. So SAGE was initially collaboratively designed and then piloted by Mercy Corps, Women's Refugee Commission, WRC, and then also Washington University in St. Louis back in 2020 in Borno State in Northeast Nigeria. So at that time, a specialist in men and boys engagement was brought on board to develop a set of 4 curricula targeted to the 4 intervention cohorts. And these were then piloted in Mercy Corps' existing safe spaces in Borno State. And this was immediately followed up by formative research conducted by WRC and Washington University. And so following some of the lessons of this pilot, Mercy Corps and WRC then obtained funding from the Bureau of Population, Refugees and Migration, our donor BPRM of the United States government, to expand the SAGE approach to refugee and host communities in Western Niger, and also to Zaatari and Azraq camps in Jordan. So if we can move to the next slide, please. Thank you. So just a quick word on this BPRM funded project, which has 3 main components. And the first is to contextualize and implement this life skills curricula, or the 4 life skills curricula that were developed for the pilot in Nigeria in a participatory way for the context of Niger and Jordan. And secondly, WRC has been continuing its mixed methods evaluative research on the SAGE approach in Niger and Jordan to build upon the research that they were already doing in Nigeria on the approach. And then finally, we have the development of a toolkit that has practical implementation guidance that aims to enable organizations to operationalize the approach in other humanitarian settings. And I'll be talking a little bit about this toolkit today. So basically what we are presenting today is the result of 3 years and counting of programmatic work and research on the SAGE approach. So if we can move to the next slide, please. So just what makes SAGE unique? So I'd like to position SAGE within the broader context of interventions that are focused on adolescent girls, which we know in the last decade or so have really evolved as a field due to the efforts of so many talented people working in GBV and child protection. So SAGE has very much been informed by the learnings of these great approaches, such as the foundational work that was done by the Population Council, the Compass, Girl Shine, and Safe interventions that were developed by the International Rescue Committee, Tipping Point by CARE International. This is just to provide a few examples. We don't have time to mention all the excellent approaches that currently exist. So just to say that SAGE shares some very important similarities with these approaches in that it is centered around a life skills curricula and girl groups. And it also seeks to engage their caregivers, given that they have a large influence on girls' lives, as well as a large say, of course, in girls' futures. That said, SAGE is set apart by three main factors. And the first is really this explicit engagement of the older male siblings, in addition to the girls and to the caregivers. And secondly is this simultaneous engagement of adolescent girls, of male and female caregivers, and older male siblings to create a sort of layering effect within the family unit. So the sessions for all four cohorts are given separately, but also at the same time, so that the different family members who are participating in the intervention are reflecting on these themes in their respective groups. And also this can create space for them to share with other family members in the home if they so wish. And the third point we have is the recommended application of human-centered design techniques, or HCD as it is known in English for short, to contextualize the curricula in a participatory way. And today, we don't really have time to go into detail on HCD. In short, HCD is a design framework that puts people at the center of a process for solving problems and issues that they face. So again, I just do want to emphasize that SAGE, while it is unique in some ways, is not to be seen as a replacement for any of the established approaches that I mentioned. Rather, it's meant to be something that is complementary to them and another contribution to the global adolescent girl intervention repertoire. And also in this sense, we've really tried not to duplicate tools. Rather, we refer to the great approaches that exist that are relevant. And then we've developed our own tools only when we feel it's necessary due to the specificities of the actual SAGE approach. So if we can move on to the next slide, please. Great. So just to provide some background on how this approach that is very focused on the family was conceived. So SAGE targets the family in the aim of tackling different forms of violence that tend to occur within the household. So that includes violence against girls in the form of GBV, but also violence against children that in many settings might be quite normalized. So corporal violence between family members, harsh disciplinary practices, verbal violence, etc. And the rationale for this approach is based on what we know about the experience and the perpetration of violence within families from global literature. So specifically, we know that women and girls are most likely to experience violence at the hands of someone that they know. This is often a male perpetrator with whom they live. We know as well that violence is something that is learned, internalized, and reinforced within families over time. And also that attitudes and behaviors that reinforce gender inequality are enacted at the household level from a young age. So for example, we know that adolescent girls often bear an unequal burden for unpaid household labor, or sometimes we see that there is a preference to send boys to school over girls, etc. And there's also some specific findings around boys and violence in the household in the global literature, which informed the SAGE angle of engagement of the older brothers. So we see that adolescent boys who witness violence in the household, say against a female caregiver or another family member, are more likely to perpetrate violence themselves. And we also know that the majority of men who perpetrate sexual violence begin doing this during their teenage years. So if we can move to the next slide, thank you. So just to say, for these reasons, SAGE targets male siblings of girls in addition to the male and female caregivers, because we know that brothers can and do act as important influencers or even decision makers in their sisters' lives. And we want to make sure that we influence boys' attitudes and behaviors from a young age when they may be more open to positive changes. So through this engagement, SAGE aims to realize this potential of male siblings to act as a positive source in their sisters' lives. It also seeks to cultivate empathy of boys towards their sisters and to encourage a mutually beneficial interpersonal bond between brothers and sisters, as well as a positive dynamic among family members more broadly. And I also just want to be clear here as well that we don't need to be strict in the way that we define members of the family unit, especially since we recognize in all settings, as in humanitarian settings, family takes many forms. For an example, an older male sibling might be defined as an older brother, a half brother, a cousin, or another close male relative who is younger. What is important is that the girls themselves consent to the participation of this individual in the intervention. And we have some more language as well in the implementation toolkit around navigating inclusion of different family members in order to accommodate different family structures that you might encounter in humanitarian settings. So if we can just move on to the next slide, please. So in addition to the way that the program seeks to encourage positive changes in knowledge and attitudes, as I said, the SAGE curriculum also aims to improve psychosocial outcomes for all 4 cohorts. And this is in the aim of helping families cope with the stressors that they face in more productive or adaptive ways. This is something that is reflected in the SAGE theory of change that was articulated by WRC and Washington University, which you see here. And so we don't have time to go over this in detail today, but I do want to draw attention to the secondary outcomes that are circled. So we see that while the desired ultimate impact of SAGE is that adolescent girls are safer from violence, the program's primary and secondary outcomes operate much more on this level of the whole family. So seeking to tackle these different forms of violence within the family and supporting more adaptive coping and psychosocial well-being. And this is something that is very important, partly because we know that violence against girls and women and GBV in general is very complex, and it's affected by many different factors, both within and outside of the household. So it's important to be realistic about what can be achieved in an intervention that spans 12 weeks, especially when we are seeking to work on deeply seated norms and values and behaviors that have persisted over generations. So if we can move to the next slide, please. Thank you. So just to briefly go over the SAGE intervention elements. So we have elements that are really essential and those that are desirable to be in place in order for SAGE to be successful. So here you're going to see some similar elements as you do with other adolescent girl approaches. So the first is, of course, the life skills curricula. So these are the curricula that are tailored to the 4 different cohorts, and these are really the foundation of the intervention, and they address themes that are relevant to each of the 4 cohorts. And then we also have, of course, girl-friendly community spaces. So these are the physical or the virtual spaces in which the curricular sessions are delivered. So this will ideally take the form of a community-based space that has been identified in cooperation with girls, with their families, and if necessary, with other relevant community members. And then, of course, staff with girl-friendly attitudes and then the right technical knowledge. So SAGE, like any intervention for girls, is just not possible without committed staff who have the compassionate attitudes towards girls and the technical knowledge necessary. So we spend a lot of time in the toolkit discussing how to hire and build the capacity of staff over time, as well as to influence attitudes of staff and facilitators. Of course, we have community outreach and engagement. This is nothing new. Like any protection intervention, it's necessary to secure community buy-in for working with girls and their families, as well as to ensure that the wider environment is going to be safe and conducive for this type of intervention. And SAGE actually drew a lot of inspiration from the IRC tools, from the Girl Shine approach for community engagement. These are really excellent and they are recommended in the toolkit as well. And then, of course, another essential element is the presence of qualified gender-based violence and child protection services. So SAGE works much more on this level of prevention and not so much on response. And therefore, it's recommended to only implement SAGE in settings where there exist qualified GBV and CP response services on the site. Whether this is offered by the implementing organization carrying out SAGE or another partner. And this is just in case that girls, women, or other intervention participants were to disclose experiences of violence, and they need to be referred for more specialized or individualized support. And for the final essential element of SAGE, we have participatory contextualization of the curricula. So we know that it's necessary, of course, to tailor curricular content to be aligned to the extent possible with cultural values, as well as the experience and the capacity of the staff and the mentors that you're working with. And it's also, of course, essential to assuring a do no harm approach. So SAGE recommends, as I mentioned before, the use of human-centered design techniques during contextualization. We've included some detailed guidance to doing so in our toolkit, but also just to say that utilizing HCD is something that is desirable, but not necessarily essential, given that it can be a very complex process, especially when you may not have the luxury of time in humanitarian settings. And then just finally, a word on mentor facilitation or community facilitation. So like a number of other adolescent girl curriculum-based approaches, ideally community members, which we term mentors, like a number of other approaches, can be engaged from the community to lead curriculum sessions with, of course, extensive training as well as close and supportive supervision of staff. And this is, again, something that's very helpful, or can be very helpful, rather, in securing local buy-in. Of course, it's important to say that mentor facilitation is not for every organization all the time in every context. So we've included some guidance in the toolkit as well to help organizations decide when it might be appropriate and then when it might be better to have staff facilitation. So if we can move on to the tool, yeah, thank you. So I just want to give a brief overview of the SAGE resource package content. So we have the SAGE implementation toolkit, which I've already mentioned. And this, as I said, articulates the steps to operationalizing the approach. So we have the theory of change, essential elements. We have detailed guidance for contextualization of the curricula. We also included a section on common challenges that can occur when implementing SAGE in humanitarian settings and how they might be mitigated or countered in advance. We have our case studies for the BPRM countries of Niger and Jordan, as well as a series of tools that organizations can use to operationalize the approach. And this implementation toolkit is currently live on the Mercy Corps website in English and French. And then an Arabic version will be following very shortly. And we'll be sure to share the link to this with you. Also, just to say that we will also be sharing the curricula that were contextualized for Niger and for Jordan eventually. These aren't currently available, but in the coming months will be available on the website. So if we can move on to the next slide. Thank you. So SAGE, like other complex interventions that are centered around girls, can really be difficult to operationalize, especially in fragile or low security contexts. And because of this, we wanted to take some time today to share some of our experiences from implementation in Abala in Western Niger. And this is a setting that presented many challenges to implementation. So for this, I'd love to turn over to my colleagues Zainabou Seydou and Ibrahim Hamidou of Mercy Corps Niger. And I hope that their internet in Yamé is cooperating with us today so that they can share their experiences with us. So Zainabou and Ibrahim, I'm passing. Oui.
Merci beaucoup, Christine, pour ta belle présentation. Merci beaucoup, chers invités. Donc, avant de commencer, il est important de vous dire que Abala se trouve dans le Dalol Bosso, au nord-ouest du Niger. Donc, Niger est un pays de l'Afrique de l'Ouest. Et il faudrait dire aussi que Abala est un département de la région de Tillabéri, faisant frontière avec le Mali. Donc, vu sa situation géographique, c'est une localité exposée aux différents groupes armés non étatiques. Du coup, les besoins humanitaires vraiment sont beaucoup attendus du fait de la forte présence des réfugiés et des déplacés internes. Et donc, dans la mise en œuvre du programme SSAGE, vraiment, plusieurs défis ont été relevés. Donc, entre autres, vraiment, d'abord les défis sécuritaires. Donc, la majorité des villages d'intervention se trouvent dans les localités où se trouvent les passages fréquents de ces groupes armés non étatiques. Du coup, vraiment, ça réduit quelquefois le mouvement de certains staffs sur le terrain. Le deuxième défi aussi, c'est les sites de mise en œuvre. Nous avons au total 9 sites d'intervention. Donc, il y a beaucoup de sites qui sont vraiment éparpillés. Donc, du coup, vraiment, c'est un peu difficile de se déplacer parfois. Il y a aussi l'insécurité alimentaire qui sévit, le manque d'opportunités économiques, surtout pour les jeunes. Et il y a le manque de priorisation des interventions dans le cadre de la protection des adolescentes par les autorités et les populations. Et un manque général de services essentiels. Ça veut dire que vraiment, là aussi, on constate vraiment qu'il y a une insuffisance quant à l'accès aux services sociaux de base. Nous avons aussi relevé les défis liés au faible niveau d'instruction des encadreurs qui sont les mentors, surtout quand on constate 50% de ces mentors, surtout les femmes, vraiment leur niveau d'instruction est très faible, et aussi les participants. Et enfin, nous avons vraiment un problème lié à la pluralité des langues. C'est-à-dire que surtout quand vous regardez au niveau des camps de réfugiés, vraiment, il y a plusieurs langues, plusieurs ethnies. Donc, ça n'a pas été facile de la mise en œuvre du programme SSAGE. Merci beaucoup. Je vais donner la parole à Ibrahim pour qu'il puisse continuer sur la stratégie qu'on a mise en œuvre, vraiment pour pouvoir vraiment continuer le travail.
Merci bien, Zainabou. Bonjour, chers participants. Donc, je m'en vais commencer à vous présenter quelques stratégies adoptées pour la mise en œuvre de notre programme. Donc, la première stratégie, c'est l'appui et la supervision des mentors. Il faut retenir à ce niveau que dans les villages d'intervention du programme SSAGE, il est difficile d'avoir des mentors avec un niveau élevé d'éducation, leur permettant de bien comprendre les curricula développés par le programme, surtout des femmes. Donc, pour nous, ce n'est pas vraiment une raison pour discriminer la grande majorité de cette population. C'est pourquoi dans le recrutement des mentors, donc, on a utilisé d'autres critères, dont entre autres les compétences en technique de communication donc orale et à l'empathie envers les filles, mais aussi l'engagement aux objectifs du programme. Donc, pour ce qui est de la stratégie adoptée à ce niveau, l'appui et la supervision des mentors, donc il s'agit là de privilégier la formation continue à travers donc des séances de facilitation hebdomadaires et des formations de recyclage. Donc, on rencontre les mentors pour les faciliter, pour vraiment les appuyer à faciliter donc la présentation des différentes thématiques hebdomadaires. Donc, je passe la parole à Zainab pour la deuxième stratégie.
Merci, Ibrahim. Donc, par rapport à la stratégie d'adaptation, vraiment, Et l'accent a été mis sur les méthodes d'apprentissage interactif. Donc, quand vous regardez, par exemple, le curriculum original était long en narration et avec beaucoup d'activités basées sur la lecture et l'écriture. Étant donné vraiment que le niveau de ces mentors est très faible, nous, on a mis l'accent vraiment sur toutes les activités vraiment récréatives. Par exemple, nous, on a rendu l'activité vraiment un peu simple en utilisant les activités comme les danses, les chants, on raconte des histoires drôles vraiment. À ce niveau-là, vraiment, on a constaté que la plupart des participants ont bien compris et le message a bien passé. Voilà la stratégie qu'on a mise en place pour pouvoir vraiment passer le message. Merci beaucoup.
Donc, merci bien, Zainabou. Donc, la troisième stratégie est l'intégration de la boîte à images. Cette boîte a été utilisée pour permettre à nos mentors, donc, qui ont un niveau faible d'alphabétisation, de bien appliquer les curricula développés, mais aussi pour les participants qui n'ont pas aussi des niveaux élevés en éducation, donc de bien comprendre le message que véhicule chaque thématique. Les images ont été aussi développées donc, sur la base du contexte socio-culturel de Abala. Donc, pour ce qui est du processus de développement de ces images, d'abord, il y a eu une séance de brainstorming avec l'équipe du projet. Après, il y a un artiste qui a été recruté donc, pour développer ces images. Donc, on a eu à tenir un atelier de pilotage de ces images donc, avec les adolescentes, les tuteurs, les tutrices et les frères des adolescentes. Après, les feedbacks des participants ont été intégrés donc, dans la boîte à images et après, à la fin, la boîte à images a été validée. Donc, pour ce qui est des détails sur les images que vous... Je ne vais pas venir avec ça. Pour ce qui est des détails sur les images que vous venez de voir, donc en haut, vous verrez un garçon qui est en train de violenter donc, une petite fille. Le jour où on a présenté cette image, donc, les gens ont commencé à apprécier, à donner même des noms donc, de ces garçons. Pour vous dire que vraiment, c'est quelque chose qui est réel dans nos différents villages. Il y a des garçons qui s'adonnent à cette pratique, qui violentent les filles de toutes les manières. Donc, la fille a eu le courage de venir se confier à sa mère pour lui expliquer la situation. Et il y a un petit référencement donc, qui a été utilisé donc, pour que la femme puisse au moins prendre la fille et l'amener au niveau du district sanitaire. C'est vraiment des pratiques où quand les filles sont violentées, elles n'auront pas le courage donc d'expliquer à leur maman la situation. Et les mères aussi, des fois, ne partent pas au niveau du district sanitaire. Vous verrez en bas, il y a une image où il y a le père, donc le fils et la fille donc, qui sont en train de discuter. Il y a le thé qui est posé. Là aussi, c'est vraiment pour montrer aux gens qu'il faudrait impliquer les jeunes filles donc, dans les discussions familiales. Il ne faut pas les écarter. Des fois, si les filles ont des problèmes, elles n'auront pas le courage de venir voir soit le père, la mère ou bien le jeune. Merci bien.
Okay, thank you so much, Zainabou and Ibrahim. I also just want to note quickly that with the limited time that we have for this webinar, we weren't able to share the experiences from our other BPRM SAGE country, which was Jordan. The implementation toolkit that is out now shares some of these really rich experiences from this context. And so we urge people to check this out, especially those who are working in the Middle East region, to take a look at this resource. So with this, I'd like to pass over to my colleagues at WRC who will discuss their research findings.
Wonderful. Thank you, Christine. As Christine noted earlier, my name is Monica Jafrida, and I am a research advisor with the Women's Refugee Commission. Alongside Andrea Corris, who you'll hear from in a few moments, I would like to present some key findings from the SAGE evaluative research. And as noted previously, this piece is led in partnership with Mercy Corps, WRC, Washington University in St. Louis, and in collaboration with some really great research partners. So that would include Consultas in Jordan and REM Africa in Niger. Next slide, please. So the SAGE program, as noted previously, is complemented by mixed methods research, which aims overall to evaluate and understand best practices and challenges in terms of the program's contextualization process, as well as its implementation, as well as to better understand some outcomes among adolescent girls, their brothers, and their caregivers as related to gender equity, protection, family functioning, and mental health and psychosocial well-being. This table here summarizes the number of participants for each research activity across all 3 program sites. So we had some qualitative research activities that included focus group discussions and in-depth interviews with parents and caregivers, some participatory group activities like storytelling and dance and mapping of important figures in one's social network through drawing with adolescent boys and girls. We also engaged adolescent boys and girls through paired interviews with 2 adolescent girls and then separately with 2 adolescent boys. We also conducted some key informant interviews with program mentors and staff to better understand perceptions of the program, its implementation, and really its curriculum and lessons and the way to which things were implemented. So some quantitative research activities also took place in Jordan and Niger and were purposed to measure changes among participants on outcomes related to mental health, resilience, family functioning, and gender norms. The survey in Jordan, which was conducted with support from the government of Sweden's Ministry of Foreign Affairs and through partnership with Washington University in St. Louis, utilized an N=1 study design, which essentially allowed for the collection of survey data from a small sample of participants at multiple points in time. So those time points would be twice before the start of the intervention itself, once at the midpoint of the intervention, and then twice after its completion. The survey in Niger was quasi-experimental and administered pre and post intervention to participant and control groups at both baseline and endline during the first and second rounds of the intervention. Next slide, please. So like the program side of things, the SAGE research was informed by human-centered design processes and participatory contextualization of tools. In both Niger and Jordan, we conducted small group participatory design sessions with community representatives. So in that case, we had male and female caregivers, as well as adolescent girls and boys who were affiliated with Mercy Corps programming, but not necessarily enrolled in SAGE. They were recruited to help co-design and contextualize the evaluation tools, such as the interview guides, the participatory activities, etc., to ensure that all remained very social culturally relevant, age appropriate, and responsive to the needs at hand. An example of note of this would be our small group design sessions with adolescent boys in Jordan. Although we had originally planned for the qualitative methods for boys in this context to include some youth-friendly arts-based participatory methods, their engagement in this process ultimately resulted in a very important change in the methods that we decided to use. So after learning from the adolescent boys themselves that they felt that these kind of art-based participatory methods might be a little bit too quote-unquote childish, and that they would prefer to discuss their opinions on the program through a more traditional focus group discussion method, WRC and our local research partner Consultus revised the tools accordingly. So now I'm going to turn over the presentation to Andrea to discuss some of the key findings. Andrea, next slide, please.
Thanks, Monica. Yeah, that's the right one. So preliminary findings from all 3 sites suggest improved changes in family functioning, attitude shifts towards gender equity, and increased knowledge of the harmful effects of gender-based violence. In particular, participants discussed how different relationship dyads benefited from the program. For example, participants spoke about the improvements in sibling relationships, changes in boys' attempts to share labor with their sisters, shifts towards nonviolent communication between siblings, and an increased sense of empathy and emotional connectedness, which Christine mentioned earlier, between male siblings and female siblings. Another relationship dyad that was significantly impacted per participant self-reports was the female caregiver dyad with her adolescent children. Female caregivers in particular really shared some truly insightful opinions about the program, and they felt that the SAGE program gave them the space to consider the importance in cultivating emotional warmth and openness with their children. And many of the adolescents, especially the girls, corroborated this change and spoke about the shifts that they witnessed and how their mothers supported them, anticipated their needs, and communicated with them. So a really interesting finding that is then corroborated across the different participant groups that were a part of the program. And interestingly, across several of the sites, we noticed that changes in the male caregiver's behavior within the family, their attitudes, their communication styles, the way that they showed up to their family and their attitudes and behaviors seemed to have a strong impact on the functioning of the other members of the family. Perceived sense of safety, feelings of improved trust, and improved communication, again, were significant shifts that participants stated that they observed in their family dynamics following the SAGE program. In addition to fostering community building amongst individuals in each participant category as well, the synchronized implementation of sessions for caregivers and children from the same family seemed to really encourage an organic and at-home community level discussion and reflection amongst family members. So in many cases, this discussion at home after attending the SAGE sessions helped to concretize the concepts that were introduced in the sessions and allowed family members to process and self-reflect together on what these concepts might mean for their personal and familial attitudes, behaviors, and practices towards one another, but also in particular towards their adolescent female siblings or daughters. Next slide, please. So here you can see two selected quotes from the qualitative activities, which provide illustrative examples of the ways in which some program participants seemingly began to experience shifts in their own attitudes, their knowledge, and their perceptions regarding gender equity and the harmful impacts of gender-based violence, and the ways that they began to apply SAGE teachings to their daily lives. Next slide, please. So across all three implementation sites, we found that aspects of normative patriarchal practices governing the treatment of adolescent girls were maintained by some participants, and we understood these to be unintended consequences as a result of our programming, and analyzing them together was quite interesting, especially given the situatedness of the program itself. So if we look at the unintended consequences we observed in our pilots in Nigeria and as well in Niger, we found that the desire to shield girls from violence and increase protective parenting practices following the SAGE program was interpreted by some caregivers and male siblings as the desire to increase restrictions on girls' mobility in public. So essentially the desire to protect their daughters or their sisters from violence was embodied and interpreted as the need to increase their restriction on girls' movements in public spaces. This was a challenging finding for us because while it can be interpreted through various lenses, as for example, a child protection lens might interpret this as a positive mechanism, more or less, for girls' protection, and as an adaptive parenting strategy in an environment where individuals are required to negotiate multiple terrains of risk and various forms of violence at the community, state, and quasi-state level. So if you think about in northeastern Nigeria, for example, the multiple forms of violence that women and men navigate either from Boko Haram, state forces, community level dynamics, etc. But a feminist analysis might interpret this differently than a child protection analysis. A feminist analysis might interpret this as the restriction of girls' mobility without also challenging the roots of violence that their parents or brothers are trying to protect them from in the first place works to maintain the structures of patriarchy that underpin that violence in the first place and diminishes their agency, freedom, and rights in the long term. In Jordan, we found a slightly different unintended consequence or aspects of normative practices that were maintained and upheld by some of the participants. We found that in some circumstances, adolescent girls attributed their improved feelings of safety and self-confidence to the fact that their relationships with their brothers had changed. They felt that their brothers were more likely to communicate nonviolently with them. They trusted that their brothers would not blame them if they shared that they were the recipient of harassment by known or unknown individuals in their community. And they felt that their brothers were more likely to accompany them when they wanted to visit friends in the camp. So while this finding suggests a significant change on the part of the adolescent boys' understanding of the violence that their sisters face, and the gender norms that negatively impact their sisters, it also suggests to us that the broader level community norms that prevent girls from traveling unaccompanied throughout the camp were still quite prevalent in structuring their freedom and their agency. And again, this is a complex finding which can be interpreted in various ways. What's important to note is the fact that the SAGE program did not work on community level norms shifting is important. And it's not surprising that the SAGE program didn't work to shift community level norms because, as you know, the activities were really aimed at the individual and interpersonal level reactions and interactions of the social ecology. But it's perhaps important to note this, that whole family programming, support programming in the future that's aimed at preventing violence against girls would perhaps be improved if implemented alongside community mobilization and change strategies, so that change can be made at multiple levels of the social ecology. The implementation toolkits provide some guidance and strategies for mitigating the risks of unintentionally reinforcing harmful norms like these. These include being mindful of the risk of unintentionally encouraging the policing of girls in the name of protection throughout the entire curriculum adaptation process. During mentor selection and training, carrying out values clarification activities with mentors to ensure that they understand the difference between protecting girls from violence and controlling or policing their behaviors and their dress. And lastly, being sure to acknowledge the legitimate safety concerns stemming from girls moving about in communities in fragile areas and sessions with caregivers and brothers. And further information is available in the toolkit, so we would recommend that if you'd like to learn more and explore this aspect more, you can refer to that resource. Thank you. I'll pass it back to Christine now.
Great, thank you so much, Monica and Andrea. Very, very interesting. So I do want to share here the URL for the implementation toolkit. As I mentioned, it is currently available in English and French. And we can also pop this in the chat box. An Arabic version will follow. And I saw there was a question in the chat as well about a Spanish version. So for this current project, we don't have immediate plans to share or to translate into Spanish, but we definitely see that this is relevant and it's something on our to-do list for the future. So we hope to do that as well. So this completes our formal presentations. I see there's already some really great questions that have been posed during the presentations. So everyone, as I mentioned, feel free to drop any questions in the chat box in English or French for our speakers. All right. So I see our first question is probably one best addressed by myself. So Konjit from UNICEF Ethiopia mentions that in emergencies situations, especially conflict settings, it's not possible to find qualified GBV experts at the local community level. Can we do with staff who are not experts? What is the recommendation? And most of the time there's almost no CP services and referrals. So this is an excellent question and one I do not have an easy answer to. You know, as I said, ideally, we really want to make sure that if we are doing this type of intervention, which, while we never ever ask people to share personal experiences of violence, we know that when we create a situation of trust over time, people are likely to disclose, or if not likely, then there's always a possibility of disclosure of violence. So it really presents harm if people are disclosing these experiences and there's really no service whatsoever to refer them to where they can obtain the support that would help them deal with the situation. So we actually have included a tool in the annex of the implementation toolkit, which helps you make a decision or helps organizations decide whether the service infrastructure in GBV and CP and actually MHPSS is adequate. So ideally we would have services that are high quality, available, but you also might in some situations have to be flexible and kind of weigh the different factors involved to determine whether it's possible to still do the intervention. I do want to be clear that if you are working in an area where there is really no protection support whatsoever, it's probably best to reconsider whether you want to implement this intervention specifically, just because of the risk for unintended harm. So urge you to consult the toolkit for that. And again, there's never an easy answer to this question, unfortunately. So second question, I'm seeing from Camilla of IMC. It would be great to hear a bit more about how to contextualize the toolkit and how girls are involved in this process. So that's a great question, Camilla. We didn't have time during this really short webinar today to talk about the different systematic processes that we recommend in the toolkit. But just in short, there's kind of a three-part process. The first would be consultations with staff, volunteers, community stakeholders to kind of understand or have a more nuanced understanding of community dynamics. And then following that, the next two processes or the next two steps of the contextualization process involve really in-depth engagement or in participatory engagement of all four cohorts, including the girls. So I don't have time to go into depth about that today, but it is mentioned in detail in the toolkit. I'm seeing as well that you have a question about whether this toolkit can be used in fragile or transient contexts. EMAP, for example, requires stability and engagement with women already in the context. To answer your question on that, this is a toolkit that was very much designed for emergency contexts, which is why it's a shorter intervention period, so 12 weeks. Ideally, if you have the luxury of time of a certain level of stability, you would utilize the human-centered design for contextualization, which also lengthens out the time that you need for the intervention. So it really depends. Basically, it can be implemented in transient contexts or post-conflict contexts. You know, if you have luxury of time, that's great, but it's not necessarily something that is necessary. Given that it is 12 weeks, a minimum of 12 weeks, it's not an intervention that would necessarily be recommended for contexts in which there's a very high level of instability and you're not sure that you're going to have access or continued access to intervention participants over the course of the 3 months. So moving on just to the next question, I see that this is for WRC. Are you able to measure if the changes are sustained considering the community level norm component was not part of the intervention? And then can you also share the evaluation, please? So I'd love to pass this to Monica and Andrea.
Hi, I can take that question. Thank you. It's a great question. So our N=1 study was our, as you know, our quantitative design in Jordan, and that design enabled us to look at changes in primary outcomes at multiple different time points. But we're not able to evaluate long-term sustained changes, so like within a year or a year and a half, et cetera, because of resource constraints and other constraints on the ability for us to design a program with that kind of scope. And Monica, if you want to jump in, you could speak about our ability to kind of measure changes through the quantitative design in Niger.
I think, yes, thank you, Andrea. I think what you mentioned though about Jordan is probably a really illustrative example. So as Andrea mentioned, we did collect data at multiple time points. However, these time points were in a relatively shorter time post-intervention. So in Jordan, for example, I believe it was 4 to 5 weeks post-intervention that we collected data again. So again, as Andrea said, we can't necessarily measure at this point sustained changes over a longer period of time, but this could be something that we would look into in future pieces of this work. And yes, we will be sharing more about the evaluation very soon, so be on the lookout for that.
Great, thank you so much to you both. It's a great question. I just want to add to, I think this has always been a challenge in a lot of the evaluative research that we have around violence protection or violence prevention and GBV prevention, is that it's really hard to look at how meaningful change occurs over time. So thank you so much for your response. So I see there's another question from Bruni. How do we keep the mentors motivated in addition to their ongoing interactive learning? So I think this question is about training and perhaps about other incentives. So just to be clear, like I mentioned during my presentation, we have a very robust training schedule for mentors that we suggest in the toolkit. So a lot of curriculum trainings in GBV core concepts, in the curriculum content, in facilitation techniques, in how to safely and ethically handle GBV disclosures and to make referrals as necessary, etc. We also, in our 2 countries of implementation, we had regular learning throughout the 2 cycles that we did the curriculum. So in Jordan, this was something that was a little bit more formalized. We had what we called continuing education trainings that were done every 2 weeks for each cycle of the 12-week curriculum that we conducted. In Niger, just given the challenges around some of the capacity issues that my colleagues presented on, we had weekly sessions. So just making sure that we were checking in with these mentors regularly. And this was in addition, of course, to the monitoring, supportive supervision, informal contact that you frequently have between staff and members, or you should have. And also, I think in terms of motivations, we also talk about the issue of mentor incentives and compensation in the toolkit. Given that this is a rather labor-intensive job, we should say we do recommend that mentors be compensated in some way, shape, or form in a way that is in line with the contextual needs, in line with their capacities, and in line with the time that they spend, the time and the effort that they spend delivering these sessions. I see that we have another question. So is there a positive role modeling of adolescent boys, males at the community level? So this is a great question. So speaking from the experience of Niger and Jordan, I don't believe, we don't at the moment have a formal activity that would help promote positive role modeling of adolescent boys and males. This is a really excellent idea, especially if we kind of expand the approach to engage more levels of the community, as Andrea mentioned, would be a recommendation for the future. So I see these are the questions I'm seeing in the chat. Does anyone else have any additional questions? We have 1 minute before the hour is over. Great, so we are at time. I just want to thank everyone again for attending today and for your engaging participation. Thank you so much to our speakers, so our colleagues with Mercy Corps Niger and with WRC. And we will be following up in the coming days with links to the resources, as well as a brief survey that we hope that you will take the time to complete. So thank you again, everyone. Merci beaucoup. À la prochaine.